Okay, welcome everybody to our vocational nursing program, class 69 orientation. So we're doing this a little bit differently this time. We're going to be conducting this as a video, and so we are going to be recording it so it is available for more of you to view and easier to access on your time. You do need to view this video in its entirety if you have not yet done an orientation with us. So the orientation process, we're going to review the program. We're going to tell you all about our vocational nursing program. We're going to review the requirements for the prerequisites that you need before you apply. We'll go through the application and we're going to show you how to access the application. And then we're going to give you a timeline for our class 69 application and enrollment. If you did attend the Zoom orientation in February, you're going to receive an email directly with the application details and next steps. You are welcome to continue to view this video. You will get details towards the end about the specific application access, but you will also get them in an email. So just be aware of that. You have fulfilled the requirement if you did attend in February. So just to kind of give you a little introduction on who is presenting here too, I am Heather Peterson. I am the director at the Health Occupations Center for all of our programs. And then we have with us Barbara Brock, who is our vocational nursing program director. So she's going to give you more details specifically about the program and our requirements. We also have Alex Cormier, who is our administrative coordinator on campus, who is going to give you some details about the prerequisite requirements for the course and the application. So who are we? A Health Occupations Center. We are actually an adult school. And so we're a public adult school. Grossmont Adult Education is our larger body that we are a part of. And we are kind of unique because we are linked to a local high school district, which is Grossmont Union High School District. So we provide adult education for students from 18 all the way into their 70s in East County, San Diego out here. We are WASC accredited as a result. So we are linked to our local high school accreditation. But we also have a variety of other accreditations with our specific healthcare bodies. So we also participate in a consortium with East Region Adult Education. And so we do a lot of work and we collaborate with our local community colleges, specifically Grossmont and Cuyamaca community colleges, but all over the county. We work with other public adult schools and community college systems here in San Diego County. I'm going to pass it over to Barbara to review the nursing accreditation.
Hello, everybody. We are part of the Grossmont Union High School District, like Heather said. The campus says that we're Health Occupation Center, but we are accredited as Grossmont Health Occupation Center. So just keep that in mind. You'll hear both. The official title of the school is HOC, but the board is accredited as GHOC. Once you get into the program and graduate, you're eligible to take the NCLEX, and it's the VN, the vocational nursing. You qualify for 1 year of credit towards a registered nursing program, or what's called a step-up program at various community colleges and maybe some private colleges. The classes that you take within the program are not transferable for college credits. So we have growth and development, nutrition, and other small classes that are in the program, but they're only good for our program or other vocational nursing programs who take the credit. Go ahead. So this year we are going to be taking 25 students, and the way it works is we accept 25, but we put some on standby, so 10, which means that students that get into the program but may get into other programs and don't choose to accept, then we take the next person on standby. We do not release that list. You'll get notified as soon as we know that you're in the program. So you'll get plenty of opportunities to get prepared to start the program. We are going to start in January of 2022, and then the next class will be in July of 2022, and we'll keep that rotation going. So now it'll be twice a year instead of once a year like it was in the past. I am the program director. There's just one of me, and we have 14 instructors, a combination of LVN and RNs in our program. And we like to have the diversity like that, so you have great people to go to, great resources. You got here to HOC's website because you know that we have excellent pass rates, 97.6. And out of the last 44 students, that have graduated. All 44 have passed in class. So we will hope to keep that going. And it looks like we will. Yay. The job outlook is still amazing. This number may be updated, but you can see there's over 3,000 jobs available in California, and you can look that information up. You can be hired just about 1,000 places. We have a brand new skills lab, and this is 4 pictures of it. And when you come here for orientation, I mean the welcome meeting, which is after you get in, we'll do a tour of it. But we have brand new beds in there, functional. We have a mother baby bed. So we do have a birthing mannequin. We have several other mannequins, and we have simulation. So you go through some training and you show us your skills. So hospital beds, we have head walls that have functioning suction, functioning oxygen, blood pressure cuffs, and we have a ton of equipment and supplies. There's a Pyxis machine there on the top right. It's a generic Pyxis machine, so it's a medication administration machine, which we do use during medication rotation. And then just some samples in the bottom left of what we have in our lab. So you will have simulation during the program, and there's a control center at top left. You can see the window where we can see you, you can't see us. So it makes it a more realistic environment. So the cost of the program, right now it's $5,500 and up. It may change. There are some fees associated with being accredited through the BVNPT, which need to be collected. So that's part of that. Then there's approximately 3,000 additional costs, which we'll go through that in a minute. So program fees, registration is 3 semesters. So you'll start in spring, fall, spring again. We do have summers off, and major holidays are all off. It also covers lab supplies and equipment and full use of the student computer lab, which is now brand new and functional. We missed it, but it's back. And a student lab supply kit, which is full of items that you practice with in the labs. So here's a breakdown of the fees. Semester 1 is $3,000, and you will get a due date for that and be paid to Renee in the front office. There's a ATI fee, which is a learning management system that we use. It's amazing. It helps you immensely in the program. And then a Complio, which is through American Data Bank. It's $12 a semester, but you pay yearly, so $24. Registration fee for second semester, $1,500 ATI, and these are approximate numbers for ATI, and then again Complio. And then third semester, $1,000, $300 again approximately for ATI, and then again Complio. And there's no scholarships available, but and no financial assistance. Actually, there are scholarships through outside sources. CCAE is California Commission on Adult Education, something like that. Anyways, they offer scholarships, and I get information on scholarships and I send it out to you. I recommend you apply for every single one. We have a student presently in the class that has gotten, I would say, 6 or 7 of them, and they add up. It's amazing how it can be helpful.
And I'll just add to this. So the financial aid, because we are technically a public high school district, so I know that's for a lot of people, we get a lot of questions about financial aid. And so we are not legally able to provide financial aid, unfortunately. We do on occasion work out in special situations to support students, but that is only in special situations and with a lot of documentation attached to it. So just be aware that you would be expected at each of those semesters to pay this full amount. Students, we have them that either look at using credit cards to pay those. There are some loans that you can take out for education that can also pay for that. And then we do work with our local career centers, but that can do tuition reimbursement, and they have their own requirements. So we do not necessarily do that on our half. You work with an outside agency to provide that. And scholarships are the same. So we do have some internal scholarships, but there are a lot of external scholarships, especially now with everything that's happened with COVID. I see scholarships all the time. We forward those to you whenever we see them. So I know for some of you that costs, if you've shopped around, it probably looks really low. If you haven't shopped around yet, it may seem like a lot, and we can do what we can to help you, but that financial aid isn't an option.
I suggest start saving now.
Yeah.
Put some money away. So here's a breakdown of some additional costs, and it's not limited to this, but this gives you a really good idea. There are immunizations that are requirements, and just so you know, that is the part of the clinical facilities that require that. We don't as a school require it, but you won't be able to go to any clinical sites if you don't have your immunizations. So just putting that up there. The physical exam that needs to be done annually, which means once a year. Drug screen, a drug test, and a background check is also annual. So $67 for that. Textbooks are approximately $900. We have around 15 or so textbooks that you need, and you need to get them right away as soon as you get accepted in, because we start using all of them except for maybe one in first semester. There are personal instruments, and I suggest if you get in, put it on your Christmas list, because your family members would love to get you something for your nursing school, and it starts in January. So a stethoscope, and we suggest you get a good working one that can last for a long time and help you through your career. A pen light, some scissors, bandage scissors, not just regular scissors, and some forceps. So that's approximately $100, with the bulk of that being the stethoscope. There are scrubs that you have to get, and you have to go through ACE uniform through us. You can't just go down there and get it. We have them come out and fit you. And the reason why is because there's an embroidery on the front and there's a patch on the arm, and that's required by the Board of Nursing. So we have to have that. And then now we also have a nursing jacket, which is a lab coat, and it also has to have the patch on it for you to be able to wear it clinical. And that's approximately $190. A nursing cap is $20. What we do is we have a nursing capping ceremony at the end of first semester. More about that later, but you buy the cap, and then we cap you at the end of first semester, and then when you graduate, you wear it at the graduation. Fingerprinting is $69. That is done at the end of the program, 1 month before you're scheduled to graduate. It has to be within that time frame. So don't go out and get fingerprints. It has to be specific ones, and I will give you that information when the time comes. Right now, the NCLEX application fee is $220. So you'll need that at the end of the program. There's also a $200 fee for scheduling your exam, and I will let you know more about that once the program starts.
I'll add in here too. I'm going to try and answer this because I know a lot of you will be attending the Q&A Zoom to ask it. If I don't answer it now, immunizations and COVID. So we do not necessarily require these immunizations. Immunizations are the facilities we send you out to. It's their requirements. And so they have the, so their general, your MMR, your Tdap, the ones that you would have gotten for childhood to go to school, those commonly. Nobody at this point that we go with right now is requiring the COVID vaccination, but they definitely could. We do have some of our other partners. For example, you may have heard Scripps is requiring any students, Scripps Healthcare, that come into their facilities have to have a COVID vaccine as of this summer. So please be aware that yes, it could at some point be a requirement. Right now, our students had to undergo COVID testing twice a week. They also had to do fit testing for N95 masks. So there are some requirements that have had to occur because of COVID, and the COVID immunization requirement very realistically could be added to this. So I want everybody to be aware of that now. It's very likely at some point going to be a requirement for employment in the healthcare field. So that's also something to just consider as you're looking at your options and your choices. That will be for any nursing program, not just ours, because we all participate in the same nursing consortium, all of the RM programs, LVM programs, nursing assistant programs. And so we all will have to work within the same requirements that are requested of us. So, so that's, just be aware of that now. And then the application, all these fees are what we know right now. Once you get into the program and you're talking a year and a half later, they may change based on what those organizations like NCLEX have changed in their prices. So just be aware of that.
And I want to reiterate the COVID testing. That is a requirement still, and it's done weekly right now. And they take it, you bring a hard copy to the clinical site, and it's like your ticket to ride type of thing. They won't let you in the facility without that test, and it has to be within a certain time frame, and it's weekly.
All right,
All right.
Alex, you're up.
Thanks. We're going to talk about application prerequisites. So these are going to be the requirements in order to apply for our vocational nursing program. So the first is to have an active California certified nurse assistant license. We'll talk about these individually in different slides as we go on, but just knowing that you must have an active CNA license to apply. Your U.S. high school diploma or equivalent. You're going to also need to have an ATI TEAS score and also anatomy and physiology. Options available through HOC, and we'll talk about that in the next few slides. So for a CNA license, as Barbara said, our curriculum is approved by the Board of Vocational Nursing, and in our curriculum approval, we accept students to our application that have a current CNA license. It's part of our curriculum, so it needs to be current California CNA license, and it must be current when you turn your application in and also throughout the entire program, meaning keep your renewal up. So if you are a current CNA, you're going to renew your license and continue renewing it. And then if you're a new CNA, you'll continue with the renewal requirements. High school transcripts. So official U.S. high school transcripts or equivalent are required to apply. If you're educated outside the U.S., we do have an resource on our website. You want to visit the student page for details, how you can get that evaluated and translated. So there's 2 steps. They'll translate it first and then they'll evaluate your transcripts to US equivalency. So please be sure if you're in that boat, you look at those options and you make sure that you get those officially transcribed and evaluated. ATI, so a TEAS score, this is the basic standard assessment that nursing programs require. So it's the test of essential academic skills. It's a multiple choice assessment done on the computer. It covers reading, English, language usage, math, biology, and anatomy and physiology. So we require the TEAS score as an official score sent to us. I think it's in the next slide. To get your transcripts sent to us, if you've taken TEAS other than the Health Occupation Center, you want to visit the atitesting.com and you want to make sure you select Health Occupation Center, Grossmont Adult Ed, to get those transcripts sent to us. That's the way we're going to receive your score. It's $27 on their website. And if you have any questions, you always refer back to the slide 13 so that you know to send it to the Health Occupation Center, Grossmont Adult Ed. We have people try and send them to Grossmont College or other schools. Please be sure that you highlight that and refer back to this Health Occupation Center, Grossmont Adult Ed, if you've taken your TEAS elsewhere and we need your transcripts sent to our offices. They'll electronically be sent here and we'll receive them. If you've taken HOC TEAS, we will automatically get your score once you've taken them at no cost. Let's see. We will take the highest ATI TEAS score. Please note that most RM programs are taking your first TEAS score. HOC, however, will accept the highest that you've taken, but they must be a minimum of 6 months apart. So if you've tried once and it wasn't the score that you hoped for, 6 months later, you try again, we will take your highest score. But to please be aware, if you're looking and forecasting for an RM program, they may only accept that first TEAS score. So study very hard. We do have a review course. The ATI's review course registration opens July 9th. So if you're wanting to do, it's a review course. So we're not teaching you math, we're not teaching you English. We're simply teaching you test taking skills in those areas to improve your scores. You'll see this link on our website. The classes will be in August to October. For math and English, it's $85. If you want the optional science portion, it's another $25. It's a Monday, Wednesday. Currently, it's on Zoom, and we will be continuing with Zoom for these classes.
We're still looking. Some of them may be Zoom, some of them may be in person. So just be aware of that. And then we may have an option for students to Zoom in.
Very good. And then if you want to look on the right-hand side, we do have some exam dates for the TEAS. in October. And registration will open approximately 2 weeks before those exam dates on September 27th. So the review course will lead you right up to those exams if you want to take it here. Okay, and we just talked about that. The tentative test dates for our ATI Ts will be October 13th and October 14th, either 9 a.m. or 4 p.m. And you can start to register for those September 27th. You can do it online, preferably, or in person if that's not an option for you.
So the TEAS test is part of the rubric to get into the program. The higher you score, the better it looks on your rubric. And also required for the program, so you have your CNA, the TEAS, is anatomy and physiology. So if you take anatomy and physiology together, or if it's A&P1 and A&P2, it needs to be within the last 7 years. If it's anatomy alone, so if you take anatomy and physiology, the anatomy portion is 10 years, and then the physiology alone is 7 years. So the physiology changes sort of over years, but the anatomy pretty much stays the same. So that's why it's that way. So I recommend you get your anatomy and physiology through a university or a college because it's transferable to an RN program. We do have an anatomy and physiology program at HOC or class at HOC, but it's not transferable to an RN program. It's only good within our VN program and potentially other VN programs. And there's the schedule for the fall. You can see that it's August through the end of September, a couple days a week for 4.5 hours. And that will be satisfactory for getting into our VN program. And you can take it ahead of time.
And this registration will be on our website. And I'm going to show you when I show you the application, how to access the application, where that is. And this will open July 9th for students to register.
And if it's been 7 years or 6.5 years since you took all this, you might want to take that class as a refresher. It's taught by one of the VN instructors, and so it's directed towards nursing, whereas an A&P in the college is just straight A&P.
Okay, so we've reviewed the program and prerequisites. So now the application process, and the application is where we are at. So I'm going to go ahead and take you just to our HOC website. So hoc.uhsd.net. You've accessed this because you're here watching the video, hopefully. But for those of you who may not know exactly how you got there, you're going to go to our homepage, HOC courses, and then you're going to scroll down to vocational nursing. I also wanted to show you this route because you will see our additional courses down below. And so you'll see anatomy and physiology for VNs. So that will have more information with the schedule and a registration link. And then you will see TEAS review down here additionally.
And CNA. Right?
Yeah, as you saw as well, the nursing assistant. So CNA. So if you don't have your CNA license yet, here's where you would access that nursing assistant page with more information and schedules and how to register. So a lot of information on this HOC courses page for you. So we're going to go to our vocational nursing page. And so this may look a little bit different if you have been here recently. We just changed this. So now it is going to have a lot more information down here. So we're reviewing a lot in this video, but there is even more information in terms of, kind of what are you going to be covering in the program, your requirements schedule, some job outlook, some links to the BVMPT facilities. The rubric that we're going to review is here, and the VM program guide is also here, which is a one-page summary of our program. But if you are looking at this point to get in, what is the application process? You're going to want to click on this button. And so this application process right now is for class 69. And so you have already completed step 1, which was right here, and you are now watching this video. So step 1 for everybody is to watch this video. This is a big investment. We want to make sure people know what they're getting into. Your second step is we've reviewed these required prerequisites. So you need to make sure you have the required prerequisites. So if you're not yet a CNA, you need to get your CNA license completed. If you need to get your high school diploma ordered, or those original copies, which Alex will talk a little bit more for you you need to do that. Not taken the T's yet. You need to take the T's. And if you haven't completed anatomy and physiology, you need to do that. So those prerequisite requirement details, we've reviewed those. You can take all of them here. We offer everything here. This is July 8th. They're actually going to be opening July 9th. So please be aware of that. I'll edit that. But the HOC courses, I showed you where those links were, where you can access all of that information on the HOC courses page. So this is optional because we know we're doing this a little bit different this time. And we had a lot of questions after we did our last orientation in February. So instead, what we're going to do is we're going to open up a block of time where you guys can just jump on. It will be myself, Mrs. Brock, and Mrs. Cormier on here. And so we will just, as people come on and ask their questions in order, we will be answering any additional questions that anybody may have. So plan to be there close to 9, but we will keep this room open between 9 and 10 if you need to jump on and ask any questions from us. And that's going to be on Thursday, July 15th. We will also be recording that session. And so once that session is complete, we'll go ahead and post that here if you're unable to make it and you want to see if you had any questions that maybe were answered during that session. So you'll see that here. And then on that VN page, you also saw the link that you can go right on the website and click on it to get to that that Zoom link in that session. If you did this now, it's just going to open up a page that says this meeting doesn't start until Thursday, July 15th at 9. So please be aware of that. Don't be sitting waiting. Go ahead and wait and go on there on the July 15th date. Step 3 is to complete the application. So the application is going to open on September 20th. So Monday, September 20th through Wednesday, October 20th. So today I'm going to show you how to get access to that application, but you're going to go to it and it's closed right now. So you're going to want to go to it and make sure you have everything ready September 20th to October 20th to complete it in one setting. Otherwise, you're just going to have to redo it if you don't have everything available with you. The application window will close promptly at noon. So don't plan to at 11:45 on October 20th, try to get on there and complete that full application, because if you haven't completed and submitted it by noon, it does not count. And we do not accept late applications. So it will be closed. There will not be an option to submit at that point. So please be aware of that. And all required documents have to also be submitted by that due date. So if you will be sending in high school transcripts or dropping them off or getting them to us digitally, they need to be to us by October 20th. We have a very short turnaround this year of getting all of those requirements logged and getting you guys ranked with that rubric. So we will not be doing anything with late documents. They'll just be returned. After that point, so again, notice this is a short turnaround for us for a lot of applications that we get. And so we are going to get a status email to you by November 15th. That status email may be that it was an incomplete application, and so you don't qualify. That status email may be that we had more applicants apply than we have spots available. And so you did not make it into the program for this semester. We also are always available. I know Alex and Mrs. Brock are available to let you know specifics about what was missing or what you could improve upon on your next application if you are looking to reapply. But the one you're hoping to get is that you have a spot in the program, of course. Congratulations, you qualified, you have a spot. And as we mentioned, we're going to be taking 25. But then we also take 10 on standby. And we have had semesters where everybody in standby has gotten into the program because we know a lot of you are applying to multiple programs. So please be aware that standby email is not necessarily a bad thing. You should be very proud also to get the standby email. But we will be sending you that information by email by November 15th. So really important. If you have not received anything from us by November 15th, it may be an issue with the email, if it went to spam, or if you entered your email wrong when you registered. So contact us if you don't hear from us by November 15th and you're waiting to know what your status is. In that email, you are going to get more information on the completion process. So you're not technically done. We do that preliminary application because we don't, unless you are at that top and you actually qualify, we're not asking for a lot of the documentation needs because we don't want to waste everybody's time unless you are competitive in that group. So from there is additional steps, and we want to review them now so you're prepared. Because again, it'll be a short turnaround. It's a couple of weeks that you got to get this stuff in before you're starting your program in January. And so their first step is you are going to have some additional documents to be submitted. So you see that there, and we have a management system. We'll help you get into it. It's called Complio, and you're going to need to get your driver's license. So a government issued photo ID of any sort. You're going to have to upload that into it. You have to have proof of that active California CNA license we've been talking about, a social security card, and then a basic life support for healthcare provider card issued by American Heart Association. No other CPR will do. It can't be Red Cross. It has to be American Heart Association, and it has to be basic life support. We do offer courses here on campus. And so at that time, we may have a couple available. December, we probably should have some available that you can take, but you can take BLS anywhere, and it's good for 2 years. It's a 4.5-hour course. And so most of your facilities, your healthcare facilities, I know Sharp does classes, and you can find other options to get that BLS if you don't have an active BLS card. If you have your active California CNA license, you probably have an active BLS. So that'll make it easy for you, hopefully. But the specific due dates, so we don't share the due dates here. This is just a generic kind of let you know what to expect. It'll be a short turnaround. So it'll be towards the beginning of December that we need you to get these in. There will also be a mandatory welcome meeting. I'll let Barbara talk a little bit more about that, but it's a couple days and it is part of your hours for the program. So when you come to your welcome meeting, you're actually starting hours for the program. So you cannot miss it. It is absolutely mandatory that you attend. You want to give them a little insight, Barbara?
Yes, and it'll probably be 3 days upcoming because there's just so much information. We go over the handbook, we go over, we actually get fitted for the scrubs and all that other stuff. Gosh, I was gonna say something, I can't remember what it was, but yes, they do count. That's what it was. Even the standby people need to come because that's when you find out most of the time when people decide not to attend the welcome meeting, that means they've given up their spot. We do contact them to see if something happened. And a lot of times they say, no, I got accepted to an RN program and we're happy for you. So don't feel bad about us. There's people on standby that are happier than you are even because now they get into the program. So it's important that you attend. And like I said, it fills your brain with so much information, you're going to leave exhausted.
Oh, and like I said, we'll let you know in that status email the specific dates and times, but probably towards the beginning of December, and it will be during the week, during the day. So be aware of that.
Yeah.
And then you will have to, so those immunizations, there's a background check, there's a drug screen before you head out into your clinical. So that those deadlines will probably be closer into January once we're right before the start of the program or within the start of the program before you're going out into the facilities. So these are the things that you will have to additionally complete even after you've been accepted. So please be aware of that.
And that last sentence about dilute urine is true. It will be considered a positive, and Kaiser does not accept a redo of the urine. So make sure it's not dilute and make sure you get it within the time frame that you're supposed to. They will not accept you.
And then going back, if you want to know where can I find that page, it's on the page I showed you with our BN application process. You can make a copy of that. You know exactly what to expect when you get into the program and you get that congratulations email. And so last thing you see here, attend that welcome meeting. And at that welcome meeting, we'll also kind of give you a timeline. So December will be when you have to pay that first semester registration is what you can expect and when to come into the office to make that payment. Okay, so this is that process. So one more time, it is HOC courses page, VN, and VN application process to access all of this information so you know deadlines and exactly what to expect. So I'm now going to just show you where can I find that application finally. So this again should look familiar, hoc.guhsd.net. This is our homepage. And you're going to want to go to the top right here. So you start a line here flying in where it says register online. So when you click on register online, it's going to take you to our registration system, which is called ASAP. So if you hear anybody talk about that, your ASAP registration, it's here. This is our actual registration system for courses. And so what you have here, it's going to take you to our medical careers page. You're going to see a bunch of courses listed. This is not where you want to be. You actually are going to want to go to the menu. If you cannot access the menu, I'm going to show you how to do it on a mobile device too, but the little house will pop that menu open for you on a desktop or a laptop. And you're going to want to go to click on medical orientation. When you click on medical orientation, it's going to have two orientation options for you. It's going to have the VN application, which is what you want. And then it's going to have the HOC application. And that is for all of our other programs other than VN. The VN, because we have a much more extensive application process, we have to have a different application registration here. You need to register to access the VN application. We do that because we need to have you in the system in order to accept that application from you. So we have to have you in here. It's public education. We have to have a recording of those that are interested in the program, even if you don't get in. So you do need to register. This is free. You're going to see, as you see here, the dates. It's a wide open dates, and ignore all of your dates, days, and times. There's no attending anything. We just have to have you registered in order to get you that application. So VN application, you're going to go to register now. If you have never registered with us, it's going to make you create an account. Please fill all that out. Otherwise, we have to follow up with you to get the correct information. So you'll fill all that information out. You'll create your account. Make sure you remember your username and password. The one thing that I do not like about this system is that once you fill out that registration, it is actually not going to bring you back to this page to register. So if that happens, just hit the house, make sure you go back to medical orientation, and then VN application where you can register for that class finally now that you have an account. If you already have an account with us, just use your name and password, go ahead and get in there, and then go to medical orientation VN application to register. Okay, all free. Again, you don't enter a credit card or anything. Mobile version. So if you go to our website on a phone, it should look like this. You'll go up top to mobile menu. It'll take you, open up your mobile menu and you'll go to register online. So same thing, you'll get a list of all of your classes. You'll go to medical orientation and then go ahead and scroll down to your class to register. Okay. Once you complete your registration, your phone or your computer will show you this. Will be a nice thank you. It shows, so this is really important because it shows that you actually completed the process. We have a lot of people who put the course in their cart and they never actually complete the registration because it's kind of weird because it doesn't ask for money or a credit card or anything. You have to make sure you complete the registration. So when you get this page, this is an important page. It means that you completed your registration. You don't have to necessarily print the confirmation unless you want to. It's up to you. But the real key to this is that it's then going to send you an email. This is the email that you will get. And so it says you have enrolled in this VN application course, and there's really important information regarding your class at the bottom here. So I'm going to show you this first. This is the most important information here because you can see it's blocked out. It's not showing it to you yet because you have to register for it. It's going to show you the direct link to click on to get into the application and to complete it and to fill it out. So this down here at the bottom of your receipt is where you're going to want to go to click on that link, or you can enter it and it's a short one. So it makes it easy to access it and get into that application. So this email is the most important part of that application process because you can't access the application unless you get this. It will come from adultschool@guhsd.net. So if you don't get it immediately following your registration, please check your spam first. So that's number one. Go into your account and check your email. So that's the second one. Because you are entering your registration information. So make sure you entered your email correctly. If you didn't, you can call or email the office here and we can verify that that email is correct and we can resend this directly to you if you happen to not get it straight from the office. And occasionally for some reason. We do have people where their spam filters are really picky about information from us. I think the word adult throws them off on sometimes. So just be aware of that. And so you may have really strong, stringent filters on your emails. So you may have to manually enter that this is an okay address to receive information from in order to receive that from us, because our ASAP system is what we use to communicate. So please be aware of that. What will you see? So when this link is active, I'm just going to show you right now, this is the live application. This is what you're going to see. There's not a lot to it because remember we told you it's going to open on Monday, September 20th at 9 a.m. and it's going to remain open until Wednesday, October 20th at noon. So this is all you're going to see right now. So if you are here, you are in the right place. You are going to have access to that application. You just need to make sure you go here in that month between September 20th and October 20th. All right. So that is how you access the application. You can go back and you can review this video as many times as you want. So kind of walk yourself through it, even as you're trying to do it if you're having issues, but you can also always call our office and we can help walk you through that process if you have more questions. So as I've said now, I think I've said it at least 3 times. So another 4th time, it will open September 20th, 2021 at 9 a.m. and it's going to close October 20th at noon. And we do not take late applications. And then all your prerequisites transcripts have to be submitted to the HOC office certified. So certified mail, we highly recommend that in person, or you're going to be able to do it digitally. And so Alex can talk a little bit more about that.
Yeah, and just to let you all know, the application is going to be an electronic application this year. So from years past, if you may have applied, it's not a paper application. We're actually using an online format. That's why the link is imperative, because that is your application. It's not anything that you print up and fill out. It's actually a Google form that will be submitted online. So as we talk about that, we talk about your prerequisite transcripts. So we need official transcripts in order to consider your application complete. So once you complete that application between September 20th and October 20th, in addition, we need your transcripts in our hands. So there are options to do that electronically with various schools. So depending on which college you have attended, you can request transcripts to be sent electronically. And we will have the official email to send those to on our website. So you can refer back to the vocational nursing tab. Under the application rubric link, we'll put the email that you can send those to electronically. We also will accept them via mail. So if you request transcripts from a high school or even a college, and they do want, or they're able to send them via mail, you can address it to us. And again, we'll have our address in that resource, where our email and our address that you can send it to, or in person, if that's the only option, you can hand deliver them here. But just know, in order for your application to be complete, we do need the official transcript in our office by October 20th, in whichever form you decide to get those to us. And we say official, it's a sealed transcript, unopened. We will be opening that transcript, so it must be official, okay?
And I will say too, if you're somebody, and this is a pretty short period of time from September to October, if you know you're going to apply and you want to start getting that together now, go for it. Just keep them in a file here. So you can send those to us as soon as you want, just no later than October 20th.
Absolutely. And that's, we will be cross-referencing, once your application comes in, that we have your transcript.
In addition to that, before we go into the rubric, I want to add that you can waive a couple classes in the program. It doesn't change the fees or anything, but human growth and development throughout the lifespan is one of them, and it has to be human, and it has to be from conception to death and dying. So it can't be just early childhood or anything like that. And then the basic nutrition for humans as well. You can waive both of those, one or the other. I don't necessarily recommend it, because you get to know your classmates, you get to know the instructors. The material that we're teaching is directly related to nursing, whereas again in the college, it not necessarily is.
It saves you a little time, but it doesn't save you any money. So it's not, and it's not really that much time either. So
No, it's not. Nutrition is less than 30 hours and growth and development is 45. So it really doesn't. But if you can include those in as well, especially now with the short turnaround, I need to look at those, assess them, and approve it or decline it. So I need that right away. So here's the rubric. We want to be as transparent as possible, so you can see exactly where you can get points. You can't see the bottom yet, but as you can see, you can get a lot of points with the T's, the ATI T's. There's the scoring. You can look at that. There's the overall T score that you get points for. You get reading, math, science, and English. So all the areas. And then we give credit for a point for being a CNA or other medical, or like a corpsman in the military. So you get points for that. So certified nursing assistant, other medical can be EMT, things like that. MA, phlebotomist, you get the idea. And we do it based on years of experience. And then we also look at, if you don't have any medical experience, because many of you are getting your CNA for the program, we still look at your non-medical continuous employment, because it shows that you can commit to something. So you get points for that as well. So be sure you put that down and that we're aware of it. We also love to have volunteer work or community service in the community. We require it within the program, so you get started. We have a certain hours there. You can see the more hours you have, the more points you can get. And then the college degree, associate, bachelor's, and graduate, and that's each. So if you have 2 associate's degree, make sure you put that down. And also remember, we need your transcript for that. Bachelor's degree, the same. Graduate, the same. Medical certification, that goes back to the other medical. So if you have lifeguard experience, things, medical terminology, I would see CNA on there, MA, home health aide, things like that need to be on there, and you get points for those as well. What we want to see is people that are committed to something, that have experience, because the more experience and medical knowledge you have, the more successful you'll be in the program. Even though it's 3 semesters, it moves quite quickly. There's a lot of learning that goes on very quickly. So we want the best candidates so that you're more successful, that you can complete the program. And then you write an essay. And in that, we have multiple people that read them, and we look at different things. I'm reading it. I'm looking at the nursing side of it, the caring aspect, things like that. We have another person that looks at the neatness and the spelling and the punctuality, and the prompt is clearly addressed. And the prompt means is what it needs to be written on it, and that is put in the application, and then clear and articulate information. So we look at that, and then Alex gets them all. We don't see each other's scores, and then she does the average and she puts in the points. So if everybody says that your essay was excellent, you would get a 3. And then we tally it up, and basically highest score gets in, and we just go down. We take the first 25. We don't necessarily look at names. We have to look at the name because we're putting the information on there. But other than that, it's directly point value driven. And then Alex puts them in order, and we go from there.
Perfect. And that application rubric is on the VN webpage. So the link, and as Alex mentioned, we'll also put information right below that of where to send a direct link for the email to send your transcripts, and the address if you want to have them mailed. All right, so this is kind of the conclusion of this orientation. So just to review, you already did step 1, you viewed your orientation video. Step 1 and step 2 is complete the prerequisites. So the CNA license, your A&P if you have not yet, the ATITs review. There's one I'm forgetting. CPR. Yes. Say it again.
High school.
There you go. The U.S. transcript. I always know there's 4. The U.S. transcript and getting those sent to us. So complete those prerequisites. That's your next step. If you have all your prerequisites done, now you're going to complete the application. So go on, register for that VN application, and then you have the link, and you're going to be ready to fill it out come September. So September 20th to October 20th at noon. If you have questions, please give us a call here. We're available for that. Or if you have any issues accessing the application. Your fourth is you're going to receive that notification email by November 15th, and then you'll submit the additional documentation that we talked about. And again, you can access that on the VN application process page. Attend the welcome meeting and register, and then you're ready to go for January. So we imagine we covered a lot of information here, but if you still have more questions, there's all those application information, deadlines, and other information is going to be on our website. So that vocational nursing page, but we also will be doing our Zoom Q&A session on Thursday, July 15th from 9 to 10 a.m. So you'll see our phone number there at the bottom. If you've got a burning question that you need answered before then, go ahead and give us a call or send us an email. Otherwise, go ahead and plan to attend that Zoom Q&A. All right, thank you guys. We appreciate your time that you spent viewing, and we look forward to working more with you.
Thank you.